Tics are sudden, rapid, non-rhythmic movements or sounds that seem to come out of nowhere. They happen involuntarily, often catching both the person experiencing them and those around them by surprise. These tics can take many forms. Some are simple, like rapid blinking, facial twitching, or shoulder shrugging. Others are more complex, such as hopping, touching objects repeatedly, or uttering words and phrases that have no connection to the conversation at hand. Vocal tics can range from simple noises, like throat clearing or sniffing, to more intricate utterances. Tics often start in childhood, most commonly between the ages of 5 and 10, but they can appear at any age. For many people with tics, there is an uncomfortable, almost itch-like sensation that appears before the tic itself. This is known as a premonitory urge, a rising feeling of tension that is only relieved when the tic is performed. While it is sometimes possible to suppress a tic for a short period, this effort builds up pressure inside, making the urge even stronger, and eventually the tic returns, sometimes with greater force. Tic disorders are classified based on their characteristics and duration. Simple tics, such as eye blinking or nose twitching, involve just a small group of muscles. Complex tics, on the other hand, are more coordinated and purposeful, such as jumping, touching, or repeating words and phrases. The most widely recognized tic disorder is Tourette syndrome, which is diagnosed when someone has both motor and vocal tics that persist for more than a year. The origins of tic disorders are still not fully understood. However, research indicates that genetics play a substantial role. Children with a family history of tics or related conditions are more likely to develop them. Scientists also believe that an imbalance in certain brain chemicals, particularly dopamine, may contribute to the development of tics. Environmental factors such as psychological stress, anxiety, or excitement can intensify or trigger tics even if they are not the root cause. Living with tics can be challenging, both for the individual and those around them. In many cases, tics are mild and do not interfere with daily life. Over time, some children may see their tics decrease or even disappear as they grow older. For others, the tics persist and may affect school performance, social interactions, or self-esteem. Teasing, bullying, or misunderstanding from peers and adults can make these challenges even more significant. Treatment for tic disorders is highly individualized. If tics are not causing significant problems, treatment may not be necessary. However, when tics interfere with learning, cause physical discomfort, or lead to social issues, intervention can help. The most effective approach is often behavioral therapy, specifically, comprehensive behavioral intervention for tics, or CBIT. This therapy helps individuals become more aware of their tics and learn skills to manage them. In some cases, medication may be prescribed to reduce the frequency or severity of tics, especially when they are severe or accompanied by other conditions like attention deficit hyperactivity disorder, ADHD, or obsessive compulsive disorder, OCD. Support and education are vital. Teachers, family members, and peers who understand tic disorders can offer the encouragement and acceptance that individuals with tics need. It is important to remember that tics are not deliberate or controllable, and punishment or criticism only increases stress, often making tics worse. Encouraging participation in normal activities, providing reassurance, and focusing on strengths rather than differences helps build confidence and resilience. Understanding tic disorders is essential, not just for those who experience tics, but for everyone around them. Accurate awareness reduces stigma, prevents isolation, and paves the way for individuals with tics to thrive. By fostering empathy and support, we help create a world where everyone can participate fully, regardless of the involuntary movements or sounds they may experience.